Hi everyone, my name is Brooke Beilman. I'm a speech language pathologist based out of Iowa. I am currently seeing patients in the acute care and inpatient rehab settings in two different trauma centers here in the state. And I also do consultations in more of an outpatient setting within a cancer clinic here in Iowa. Previously, I was based out of Kansas City, Missouri for the past 8 years, where I have utilized manual techniques in the outpatient, inpatient rehab, and acute care settings. And I began my journey with manual therapy in the outpatient setting as the lead speech language pathologist in a head and neck cancer program. At the time when I took the course, I believe it was either in late 2017 or early 2018, I came across the need to utilize these techniques in my work as I was seeing numerous patients with trismus secondary to head and neck cancer and treatment for head and neck cancer. And at the time, the center that I was working in was a trauma center that pulled in patients from a lot of rural areas. And so a lot of my patients didn't have other therapists that they could see farther out near where they live. So we were the closest rehabilitation team in the area. And I realized gaps in my own clinical knowledge as to how to treat these issues, in addition to issues such as TMJ unrelated to head and neck cancer. And so as a result of this need, I hopped on a plane and went down to Houston, Texas to take a course taught by Walt Fritz at the time. Later on, luckily, we ended up having other therapists join our team in both PT and OT who also specialized in manual techniques. So it ended up being a really beautiful interdisciplinary collaborative approach. However, initially, I did take the course from Walt because there was no one really in the area close by for the patients that I was seeing to have some of their issues related to swallow and voice and jaw range of motion addressed. And so this is kind of where I saw a gap in my clinical education and took Walt's course. So upon taking Walt's course, he did recommend that we immediately implement these manual techniques upon returning to work the following Monday. And so in following his advice, I did immediately implement the manual techniques taught in his course upon returning to work the following Monday. So since taking that course back in, like I said, late 2017 or early 2018, I have utilized manual techniques in a variety of work as a speech language pathologist with a variety of patient populations. Most notably, a lot of my work has focused on treating dysphagia for people with head and neck cancer. So as a result of the cancer itself or the subsequent treatments. And this can look like issues with swallow function, airway management, and voice changes, as well as issues with trismus and lingual range of motion, of course, which in turn impacts swallow function and speech intelligibility. However, I've also utilized manual techniques for other patient populations, such as people with TMJ and muscle tension dysphagia and muscle tension dysphonia in the outpatient setting. So it's come in handy in a lot of different settings. Like I mentioned, I utilize this in outpatient, inpatient rehab, and acute care. And I will mention that in working with people with head and neck cancer, I personally like to address swallow, airway integrity, and voice from a multidisciplinary approach when possible with PT and OT colleagues. So the next topic I wanted to talk about is just sharing patient experiences when incorporating manual therapy. Initially, like I said, I realized the gaps in my own clinical understanding for how to address swallow function specific for people with head and neck cancer. I was doing all the things I knew to do, including utilization of traditional swallowing exercises, as well as incorporation of progressive overload and the principles of exercise physiology, utilizing boluses and other techniques to help address swallow function, such as prophylactic approaches. However, I often saw that patients would hit a plateau, specifically in the head and neck cancer population. And so this is what spurred me to pursue further education in manual therapy. And in utilizing and beginning to incorporate these techniques for my patients, I saw pretty much immediate results for these patients. And by immediate results, I mean that I was seeing significant improvement even just in one session. So even for patients who are farther out down the line from treatment with head and neck cancer, 5, 10, 15 years, these are patients with what we have previously referred to as quote unquote woody neck syndrome, or you may have heard this called RFS. I have seen in my clinical practice immediate improvement for these patients. And some of those improvements are, improvements in patient reported outcome measures, so PROMs, as well as immediate visual improvement in external tissue integrity, as well as immediate improvement with internal anatomical presentation, which we are able to visualize with fees. So for example, I was seeing this back when I first started implementing manual techniques, but even more recently, and having moved to Iowa, I've been able to collaborate with some wonderful speech pathology and occupational therapy teams here in the area. And we recently we wanted to do some education for the cancer team to demonstrate how important manual techniques are. So we did a FEES, and then we did about 40 minutes of manual techniques, and then we did a post-treatment FEES, and everyone in the room was able to visualize internal anatomical improvements and improvement in functional outcomes as well, which we were able to rate with the digest FEES. So just an example of both the ability to visualize external improvements as well as internal improvements. And I always encourage people who are utilizing manual techniques to try to incorporate instrumental evaluations and objective measures whenever possible. But additionally, I think that patient-reported outcome measures are really critical as well to get that patient buy-in and to help the patients understand how they actually can be empowered to utilize these techniques at home outside of clinic to help address whatever issues that we are targeting, whether it's swallow function, airway management, or vocal quality. The other thing that I wanted to mention about Walt's course that really significantly impacted my career was his instruction and encouragement for shared decision making. And so this is something that really changed my clinical practice, not only from the utilization of manual therapy, but in everything that we do as therapists. And when it comes to speech language pathologists, of course, we are often talking about compensation and rehabilitation for swallow function, and really being encouraged by Walt to have shared decision making principles changed my outlook and my practice as a newer clinician back in 2017, 2018, and really has changed the trajectory of how I talk about recommendations and help patients make decisions that are best suited for them. And so I can't speak highly enough about shared decision-making principles and Walt's outlook and encouragement and guidance in making or in helping patients make decisions that are shared decisions with us as the therapist. So I hope that you all enjoy this course. It has truly changed my career and has really helped me help patients understand not only the physiology of what is going on with their swallow function, airway integrity, and voice, specifically for people with head and neck cancer, but also has really helped me empower patients to implement these techniques at home, whether it's the patient themselves or caregivers, to manage these issues long term and kind of take matters into their own hands, which is really, really empowering and great, in my opinion, to help our patients be empowered to address these issues independently outside of the therapy setting. So I can't thank Walt enough, and I hope that you all enjoy this course.